Alrighty, hello class. Today I'm going to talk to you about asthma. According to Severe Asthma Toolkit, when someone has asthma, the airway muscles tighten and become narrower. And this muscle is often called a twitchy muscle. This blocks the flow of the air and makes it harder to breathe, and this is called bronchoconstriction. Someone with asthma has inflamed walls, like airway walls, and it leaves less space inside, which makes it harder for them to breathe. Mucus can be known as a protective response, and someone with severe asthma, if the mucus becomes too excessive, then it can cause it can block the inside of the airways. And so if somebody has asthma and their airways are already inflamed and then they get excess mucus, it's gonna block it, and so they're not gonna be able to breathe at all. So I've got some pictures here to show you. Right here we've got a normal airway. This is an airway with for someone who has asthma, and then this is an airway of somebody that is currently having an asthma attack. And then down here we've got our normal healthy airway. It's it's just normal, and then over here we've got our airway of somebody that has severe asthma. We've got the thickening of the wall, we've got all this buildup, and so you can just tell it's constricted, and it would be harder to breathe through that. So according to Cleveland Clinic, there are many different types of asthma. Intermittent asthma is where the asthma symptoms come and go, they're just not always there. Persistent asthma is when the symptoms are always there, they don't ever leave. Allergic asthma is when the asthma is caused by something that people are allergic to, like mold, pollen, and pet dander. Non-allergic asthma is when it is caused by something that's not allergies. Adult onset asthma is when the asthma develops in somebody that is over the age of 18. And then we've got childhood asthma, and that's whenever it develops as a kid. Exercise-induced asthma is whenever the asthma is triggered by exercise, so it just gets worse when exercising. And lastly, we've got occupational asthma, and this occurs in people that are working around irritating substances, and those irritating substances that they always work around just make the asthma worse. Now on to how we get asthma. Asthma can't be transmitted from person to person, but there are other ways that it can be developed. According to American Lung Association, there are many things that can cause asthma. Most people aren't born with asthma, but they can be born with the gene from their parents. And being born with the gene is the most common way of developing asthma. If your parent has asthma, then the child is 3 to 6 times more likely to develop asthma than somebody that doesn't have a parent with asthma. Some other things that can cause asthma include allergies, pollen, dust mites. We've got viral respiratory infections, occupational exposures, smoking, obesity, air pollution, just things like that. Alrighty, and then now on to our symptoms. So according to Mayo Clinic, the symptoms of asthma can be different for each person. Some people have asthma symptoms and that last all the time, and some people have symptoms that are so they are sometimes come and go, and these are called infrequent asthma attacks. Some symptoms include shortness of breath, chest pain, your chest feels tight, wheezing when you exhale, trouble sleeping because of the shortness of breath, so they just feel like they can't breathe when they're laying down and they can't breathe when they're sleeping, and then coughing or wheezing attacks. And lastly, we're going to talk about some treatments. So asthma can't be cured, but there are treatment methods and medications to help control it, but it won't go away. So according to Asthma and Allergy Foundation, there are 4 different types of asthma medications. One of the types of medication are called quick relief medications, and these give a fast relief of sudden symptoms. So these medications are take as you need medications, and you take them whenever you see a sign of your first symptom. Another type of medication is called a controller medication, and these do what they sound like. They help control your asthma. and help correct the changes of the airways. So it helps the inflammation, it helps the mucus build up, and it'll just like help get your airways a little bit better than they would be without the medication. Another one includes taking a combination of the quick relief and the controller. So you would always be taking your controller, but then whenever you see a first sign, you're going to take a quick relief to help reduce those symptoms and make it not as bad. The last one includes biologics, and this treatment targets the cells to help prevent the swelling inside the airways to help make breathing easier. There are also different types of like delivery devices for asthma medications. The main ones include inhalers and nebulizers. There are different types of inhalers. This includes like the metered dose inhaler, dry powdered inhalers, breath actuated inhalers, and soft mist inhalers. Alrighty, thank you guys for watching.